Hi everyone, welcome to this session of speaking to toppers. And here's a topper who's very close to me, and we'll come to know why. But firstly, he gave an exam which is one of the most competitive exams. If you go through the mainstream branches which are there, rheumatology is one branch where you have hardly a handful. Handful is also I think five, but it's not even five most of the times. So, firstly, deciding on giving this particular exam, especially in the INS, is part of things, and then going on to ace this exam with a great rank of both AIMS as well as common merit rest of rank 2 is a phenomenal achievement. So, like, hearty welcome, Sathvik, and how are you feeling firstly after this achievement? And now that your exams are over as well, INS is over, NEETS is over.
Yes, thank you, sir. I feel a lot of relief mostly because it was a very anxious and confusing couple of months between finishing my MD and the entrance exams. Now that I've decided where I'm going for the next 3 years, I'm very relieved mostly.
Great. And obviously I know you, but let the viewers also understand your academic journey, where you're from, and just introduce yourself.
Yeah. So I'm from Hyderabad. I did my MBBS from AIMS New Delhi, and I finished my MD medicine from PGI Chandigarh. I finished in August, and then we had duties till the end of August, and then after that I started preparing for the exams. Yeah, that's pretty much it.
Great. So when I joined Jipmer, so it was one of the things that people used to say that you're covering all the three INIs, AIMS, PGI, and Jipmer, and I thought there might not be many, but as soon as it's like mine is ending, like you come again, and it's another coincidence that you are from the same school. So same school, same UG, PG, and SS. So that's a great coincidence, I'd say. Yeah, so
Yeah.
let's now get on to what our juniors would like to hear, because obviously Rumat is something that I'm sure a majority of students would feel it very interesting to read. There's no doubt about that. But there's always this barrier about how to prepare, because there's very less seeds. There's a little bit of uncertainty as to how the practice is. So, firstly, through how did you choose this course of preparing for rheumatology, or per se deciding on giving this rheumat exam?
So, like, especially in PGI or internal medicine residency, we have a dedicated almost at least 1 month. Some people get posted in Rumat for 3 months. So I was lucky enough to be posted in Rumat for 3 months. So during those 3 months, I got a chance to get exposure to a wide variety of cases, and the faculty and senior residents at PG are very great. They kind of uh, helped me, they kind of encouraged me to take up Rumat. And then eventually at the end of, like, I didn't decide my first year. After finishing MD, I kind of reflected on my residency, and I thought those 3 months were the months I felt most comfortable working uh, in the hospital. So yeah, eventually I made up my mind and decided to prepare for Rumat.
Great. And so, how did you then plan your strategy of preparation, like the crux of
Mm.
preparation, especially INI? Because again, like we have, I think, 6 or 7 papers only which have happened with respect to
Yeah.
INI. So we don't have a very big cohort of previous year questions, and also it's conducted by different institutes as well. And also, like the core part as well, you have two big textbooks. You have Hochberg as well as Kelly's, which again there's
Mm.
no specific certainty that they're going to ask Kelly's or Ogberg. So how did you navigate all these variables while preparing your planning your prep?
So first of all, I asked my senior residents, like I had the luxury to be surrounded by people who had already cracked the exam before me. So I asked them what they had done, and then I formulated my own strategy because there's a vast amount of material to cover, including Kelly, Horsberg, and even Harrison. Harrison, the new edition, has come out with Rumat being more or less replaced by the youth. It's almost new compared to the previous editions. So I had to cover three different textbooks over a span of approximately 2 to 3 months. So I decided, like most of my seniors did, I prioritized Kelly as my base textbook. And after finishing a reading of Kelly, like I didn't read cover to cover. I don't think it's possible to read cover to cover in a span of 2 to 3 months. So I just prioritized whatever topics are being repeatedly covered in the previous year questions. So that took me around 1 month almost to read the first reading from Kelly. And then on top of that, after reading Kelly, I kind of layered on Harrison and I just added the extra points. And then on my second reading only, I opened Hochberg. I didn't open Hochberg prior to that. I couldn't really cover most of Hochberg. I just did the main diseases part from Hochberg. And the disease activity scores and all were kind of like more well described in Hochberg rather than Kelly. So those portions I kind of focused on. And to review the material, I used flashcards. So flashcards kind of help me review the material multiple times. Like the main edge that people who've been giving the exam multiple times get is because they've covered the entire syllabus multiple times. And I had to do that in a short span of time. So I made flashcards for whatever volatile information which I felt I had to review multiple times. So that kind of helped me revise towards the end also. So in the last week before the exam, I just looked at my flashcards and I gave the exam. Apart from that, obviously the previous year questions that you've done in your videos, those I'd used to identify which areas I had to focus on more. So yeah, that was basically it. I focused mostly on the important areas and then I kept adding information to it.
Great. And especially in with respect to the confusion that is there with NEET assess, because especially in September, October, this phase of the year, there's always this overlap between NEET assess and INSS.
Mm.
And this time also it was initially they said NEET assess first, then INSS. Eventually it turned out to be the other way around. So this confusion is always there, especially for rheumat aspirants, because the seats in INI are so less that you always have to have a NEET assess plan in hand. So how did you think about this?
I was actually just hoping that the NEET assess would get postponed. I didn't really have a strategy to prepare for NEET assess because NEET assess is a very unpredictable exam. I don't think anyone can prepare for it definitively. I was kind of banking on INSS happening and then preparing in the remaining time for NEET assess. In between in October, I'd given MRCP too, so I revised a good chunk of internal medicine during that time. So even if the exam had happened in November, I was counting on that preparation helping me out. But luckily, the exam did get postponed. So mainly, I was just studying for rheumatology specifically and internal medicine, whatever topics were repeatedly being tested in INSS, those I've read. And I'd recently given my MD final exam, so that MD medical knowledge was kind of fresh in my mind. So yeah, I was just banking on that.
Yeah, so fair enough. Like you had your MD just completed, you gave your
Mm.
MRCP, and apart from that, you were primarily, focused on INI. And okay, you could have
Mm.
seen where the NEET SS goes. You could have possibly, if it didn't go well, also if
Mm.
INI didn't go well, you could have given another INI. It was a very, fair plan.
Yeah.
And next we come to the second part of INI, that is the interview, because now that even PGI has interviews, so you have interviews strongly important for rheumat as well. So how did you do that, and also how did you practice? Like obviously you used your flashcards, but what about the MCQ practice?
So for MCQs, I did use doc tutorials, QBank, and I did the test series. There were like three grand tests during the portion between August and the exam. So I'd given that. And for the interview specifically, I went through the questions they had asked previously. So mostly it's like one faculty kind of asks general medicine questions and everyone else asks rheumatology specific questions. So the questions are more or less unpredictable, but they are answerable if you have a fair idea of the branch. In retrospect, I think I should have practiced answering the questions because though I knew the answer, it was actually kind of tough to formulate and answer on the spot. So that was one area I think in retrospect I should have focused more on. This time around, I think none of the previous questions were repeated exactly. Almost all the rheumatology questions were new only. But apart from a couple of tough questions, most of them are like clinical questions. Like if a patient with lupus nephritis comes with proteinuria, urine dipstick is possible. Like how would you approach the patient in the OPD? Those kind of clinical scenarios were asked. So yeah, I don't think it's possible to prepare specifically for the interview. It's just your preparation over the course of the preparation for the theory paper that will get you through the interview.
Yeah, I think I totally agree that the interview questions are not getting repeated. This is what I
Mm.
have seen when I do my mock interviews, when I discuss the previous year questions. I've seen that one exams questions and the next are like significantly different. It's not the same case with respect to the theory paper where there are
Yeah.
repeats, there are repeat questions, there are repeat topics. But interview, yeah, possibly because there are less number of interviews, or the faculty are, making it a point to ask different questions, whatever the reason may be. But yeah, it's completely true
Yeah.
that they are different. At the same time, as you said, it's important to have a mock interview session with yourself, even, like, keep, some flat slide, make random slides and do an interview yourself before the interview, because articulating the answers is, where
Yeah.
sometimes the difficulty comes in. Right. So now, with your experience, what would you like to tell your juniors through the MD, especially in a branch like internal medicine, in a college like PGI? It's, I know it's very hectic. So how should they navigate through the residency at the juncture of completing their MD, taking that decision, and then, preparing?
So I think during MD, it's just important to just do your residency. I don't think it's worth focusing on and preparing specifically for an entrance exam during the 3 years of residency. If you're determined to crack it at the end of your residency, maybe the last 2 semesters, you can kind of focus on, like, if you've managed to figure out which branch you want, you can focus on that. But the majority of people in my batch, at least, had taken almost the entire 3 years to decide what they wanted. And I think it won't make much of a difference. If you sit for 2 to 3 months, you can crack the exam. So I'd advise my juniors, at least, to during MD, to focus on the MD residency. And after MD, once they've identified which area they would like to take up super specialization in, then they can sit for a couple of months and prepare for the entrance.
Agree. Like, especially in your first 2 years, it's, you don't need to know the guidelines of rheumatoid arthritis.
Yeah.
You don't need to know the guidelines of ANCA vasculitis. You should rather, try to understand the approach to an ulcer, an approach to a gangrene,
Mm.
whatever is
Yes.
covered in the first part of Harrison, if I can put it
Yes.
that way, and obviously the basics of the management part. But it's not important at all to read it in an entrance exam point of view.
Yes.
So
Definitely.
the two different things, and that's what it should be focused upon. I agree. So finally, I know that you'll be really happy you're joining JIPMER very soon, but in this whole journey, you would have a lot of, people who supported you, who would have a role in, reaching this stage. So a vote of thanks for all of them.
Yes. So first of all, I thank my parents, especially my mother. They supported me throughout my journey, and like, I sat at home and they provided a supportive environment for me to just sit and study and not worry about anything else. Apart from that, it helps to have a good peer group who are all also preparing for the same exam. So my batchmates were all preparing for INSs in different specialties. So having them around also helped me a lot. And obviously, you helped me a lot. I asked you for when I was deciding to take up rheumatology at the beginning, I'd ask you how to approach preparation and all. So, and before the exam, also, I asked you multiple doubts, and you clarified them in WhatsApp and all. So, yeah.
Thank you so much. It was great talking to you. I think we'll meet somewhere in Hyderabad or Pondicherry or somewhere, as
Yes.
in path, and obviously in conferences ahead. Very nice
Yes.
talking to you, Sathvik, again.
Okay.
Bye.
Thank you so much, sir.